Hi, my name is Robert Shelley with Shelley Law, and my law firm assists physician assistants with employment contract and independent contractor agreement issues. Today I'm going to talk about RVU compensation for physician assistants. So just kind of a brief overview of how it would work if a PA is compensated via work RVUs. So in healthcare, there's different compensation models. I'd say the three most common would just be a straight base salary, where you're just given a guaranteed base and you do your work and that's it. The second would be net collections. So you would get a percentage of whatever the practice would receive on your behalf based upon your personally performed services. And then the third way would be a RVU compensation model. And obviously there can be hybrids of a mix of all of the three in different combinations. But today we'll talk about RVUs. And so RVUs is a relative value unit, and it's a kind of a measure of value provided by the Center for Medicare Services, CMS. And essentially what they do is they'll assign a number to every encounter, CPT code, what have you, that the PA could have. And that number increases due to duration, so how long you're with the patient, and then also the intensity of the visit, meaning, what is the acuity of the visit with you and the patient. The higher the acuity, the longer it lasts, the more RVUs it will generate. And there's a giant list that CMS provides every year that has those numbers. And then the next part of being paid via RVUs is what's called a compensation factor. And so essentially it's very simple. You would just multiply your RVUs generated in a period of time times a numerical or monetary value. And so what is an average RVU for a physician assistant? Well, that's tough to give you an exact number. For a number of reasons. It's based upon specialty. So in what area are you assisting the physician with? Two, geography, where you are in the country dictates what type of compensation you'll receive. And then three, the setting. Are you in a private practice, which honestly doesn't use RVUs very often? If you're working in a hospital or a healthcare network that utilizes RVUs, that would be much more common. But if you're just working in a private practice for a physician-owned group, it's pretty unlikely that they're going to use an RVU compensation model. Now, how does it actually work? Well, there'll be some kind of reconciliation period. So most of the time it would be monthly or quarterly. And so they would essentially come up with like a base draw number. So you would get in your paycheck a regular amount, and then let's just say it's a monthly reconciliation. So whatever your base draw was, so let's just say it's $10,000 a month, and that's paid out at the regular pay periods. So they would take the $10,000 paid out to you, and then they would just multiply your RVUs generated for the month times whatever the compensation factor is. And if you have generated more than the $10,000 that they gave out, then they would pay you a bonus at the end of the month, usually within 7 to 14 days would be a standard amount. It's difficult to find, at least I find it's difficult to find really great data that I can trust from the different organizations. So MGMA, many of the PA associations could have this data as well of what an average RVU would be. But the sample size is pretty low, to be honest. And so I don't think you can necessarily trust the data. So for instance, the median RVUs for a hospital, for a primary care PA, would be around $30. So you would multiply whatever RVUs generated times $30, and that would be amount. And then the median amount of RVUs generated by a PA working in a hospital or a hospital type setting would be around 3,500. So you would multiply 3,500 times 30, and then that would be around the amount that the PA would get just for the base salary, which would be a little less than average as far as what comp would go. I mean, I think most PAs who start off are making probably somewhere around 110. Once again, this is just a general average. You'd have to factor in the geography and the specialty and all that kind of stuff. So that's kind of how RVUs work. I think this is probably the least used model amongst paying for a PA. Most of the time, it would just be a straight base salary for whatever reason. But if you are going to be compensated via RVUs, you need to kind of have an idea of what is and isn't fair. And then you also have to take into account outside factors will play a big role in the efficiency of the PA. So what do I mean by that? Let's just say you're in primary care and a physician-donor group. Well, certainly how quick you get through the patients is one factor, but outside of your control is the front desk. How are they scheduling? Are they rooming the patients efficiently? Who's taking the H&Ps before you get in there? Is your schedule set up to maximize your efficiency? All of those factors will go into like what type of EMR they use. That will all determine how many patients you can see. And obviously the more patients you see, the more RVUs you can generate. So it's not 100% the PA's fault if they are not hitting an RVU target. There are multiple factors that go into it. So if you're looking for a job, you need to ask the questions. Are you adequately staffed? How efficient are you at rooming? What's the turnover in the MAs or the nurse, the RNs, LPNs, whoever they use in the office that you're working in? If there's a high turnover, it's a red flag. And then I would ask, what's the turnover like for the PAs as well? Is this the first time that the office has used PAs before? That's really a tough transition, I find. For an office that's never utilized an AHP, so an NP or a PA, they generally don't know how to maximize the capabilities of the PA or the NP. And it's a tough transition. So I would look into that as well. If you're the first person or the first PA they've used before, you may want to rethink the position. So anyway, that's a brief overview of RVUs for PAs. If you have any questions about an employment contract or independent contractor agreement, feel free to contact my law firm at the contact information listed below in the description. If you have any questions, feel free to leave them. I'm happy to answer them. So anyway, hopefully it's helpful. Appreciate you watching the video. Take care.